The U.S. has surpassed 40 million coronavirus cases since the start of the pandemic. More than 1.1 million weekly cases were confirmed over the holiday weekend. That's an almost 300% increase from the last Labor Day. And data show hospitalizations have more than tripled from this time last year. David Begnaud reports from Louisiana.
Today, the American Academy of Pediatrics reported the most COVID cases among children since the pandemic started, more than 250,000 last week. That topped the 200,000 cases reported the week before. Texas hit a record for pediatric COVID patients over the weekend, nearly 350 children hospitalized statewide.
Unfortunately, here in the South, where we failed to implement mask mandates in addition to vaccine mandates, as schools started to open, we're now seeing a lot of kids and teachers become infected with COVID.
She's maxed out on these medications.
Hospitals, particularly in southern states, are facing a crush of new adult COVID cases, too.
COVID is kicking humanity's ass. Every time a COVID patient comes and checks in, it's like, damn it.
Dr. Hassan Kakli works in the ER here at El Campo Memorial Hospital in Texas, about 70 miles southwest of Houston.
So 20 patients in the hospital, only one does not have COVID.
Wow.
That's how it's been, past 3 weeks.
Dr. Kakli and his staff aren't just battling COVID.
Bye-bye. No, they don't have any beds.
They're on the phone daily trying to find empty ICU beds for critically ill patients who they don't have the equipment or the specialists to treat here.
Just get me on the phone with a radiologist.
Dr. Kakli's persistence paid off, though. He was finally able to transfer a cancer patient to Houston.
We're all relieved and happy that we finally got a patient out after 4 days. Like, that's where the bar is right now. Like, we got him out eventually.
A short time ago, I checked on that cancer patient, and her daughter told us that her mom now has blood clots in the brain and in the heart. They only found that out when she got to the Houston hospital, and they were able to do the type of imaging that they needed to do in order to diagnose her. They couldn't do that imaging at the small rural hospital in El Campo. Bottom line, the Houston hospitals are full. They're packed with COVID patients. And it's to the point where they're telling rural hospitals just one town over, I'm sorry, we can't help you. We can't accept your transfer because we don't have any space. Elaine?
All right, David Begnaud, thank you. For more, let's bring in Dr. Shikha Jain. She's an assistant professor of medicine at the University of Illinois, Chicago. Dr. Jain, welcome. The U.S. has surpassed 40 million coronavirus cases since the start of the pandemic. How would you describe the state of the pandemic now compared to a year ago? What are your most pressing concerns?
Thanks for having me on, Elaine. So my biggest concerns right now are we have a way to get this pandemic under control that we did not have a year ago. We have these amazing vaccines that can prevent people from getting into the hospital and prevent them from dying from COVID. Unfortunately, what we're seeing is a very high number of unvaccinated individuals who are being admitted to the hospital. I tell people that they are actually at a higher risk for contracting COVID now if they are not vaccinated than they were a year ago, because all of those risk mitigation strategies, the social distancing, the masking, the concerts being shut down, all of that, those types of things are not in place. And we have more contagious variants right now. So if you are not vaccinated, there is a much higher chance you're going to contract COVID now than a year ago.
So you just answered my next question, because data show the average number of weekly COVID infections in the U.S. was nearly 300% higher this Labor Day weekend compared to last year, but 53% of the population is now vaccinated. So why is that infection number so high? Is it for all those reasons that you just spelled out a moment ago? Those mitigation steps simply aren't in place.
The mitigation steps aren't in place. We have new, much more contagious variants that are spreading much faster. And we're seeing now kids getting impacted as well, which we weren't seeing kids impacted as much last year. We had most kids at home doing virtual learning. Now we have schools back in session. We have people who are not vaccinated and who are vaccinated who are out socializing, living life with a much more contagious variant that's spreading. And the unvaccinated population especially is at high risk. And so we're seeing those people who are not vaccinated get the virus and get very ill and then get sick and transmit it to other people.
You mentioned kids. New data from the American Academy of Pediatrics show weekly coronavirus cases in children have reached a record high. Infections have been rising for 10 consecutive weeks. So how concerned should parents be with the new school year now underway?
I think parents should be very concerned. I have 3 young children myself, and they were in person learning all of last year, but they did it very well. The school had masks in place. They had social distancing in place. Our numbers in Illinois started to look a little bit better. Unfortunately, across the country, there are schools that are not doing things like requiring masks. They are not doing those social distancing requirements. And there's a lot of places where the numbers are so high, it's really impossible to avoid meeting somebody who has COVID. So if you're a parent and you're sending your child to school, I would strongly recommend making your kids wear masks, get them used to wearing masks so that they can wear them comfortably and regularly at school, teach them about social distancing, and teach them how often they need to be washing or hand sanitizing their hands. And if your kids are sick, keep them home. Don't take them to school. Get them COVID tested and have them quarantine or isolate until their COVID test comes back negative. We need to be extra cautious now because we know kids can not only get impacted, kids can get very sick and they can die from COVID.
Well, President Biden is expected to outline a plan to stop the spread of the Delta variant and boost vaccinations later this week. In your opinion, where should public health officials focus their efforts to get this pandemic under control?
I think there really needs to be a huge focus on the fact that it's not just a one-pronged strategy, meaning we need to not only get everybody vaccinated as quickly as possible, we need to address all of that misinformation and the infodemic that has really plagued the country and has made this such a polarized issue. We also need to encourage everyone to be wearing masks, especially when they're indoors. But if you're outdoors and you're in a space where you can't maintain 6 feet apart from people, you need to be wearing masks even outdoors, because these new variants are very contagious. We also need to remind people that if you're feeling sick, you need to get yourself tested. And really, it is more important now, more than ever, that you need to go get yourself vaccinated, not only for yourself, but to protect your communities, protect people who aren't able to have a really great immune response from the vaccines. We need to get everybody vaccinated if we want to get back to some semblance of normal life where we're not worried that COVID is everywhere all the time.
All right, it's hard to imagine at this moment that kind of environment. Dr. Shikha Jain, Dr. Jain, thanks very much for sharing your expertise with us.
Thanks for having me.